Right, reality. I was just massaging myself because I've been lying on one side and my hip had all sort of blood pooled a little bit, and then accentuated all the tight fibromyalgic muscles. So I was trying to join them all back up together again, you know. Got through the hip, found the leg was a little bit tight, started on the leg. Quite difficult, because when you're just coming out of your sleep, you're trying to reach down and do massage on yourself. You've got to actually be quite fit to do it, yeah? You've got to be muscularly strong to do it. Because what happens is, during the massage, any weakness anywhere is going to show up, especially if you've got weakness in your hands or your arms after doing it for so long. This is the massage that's not proven, by the way. Back in the 40s to the 60s, people were learning that wellbeing was of interest to them. In the hospitals they had back rubs, so if the patients were lying on one side for too long due to pain, or maybe a cast or something, or a bandage in a certain position that they couldn't move and weren't allowed to take off, well, the nurse would come along and give you a quick turn, gentle of course, not like your home care people, taking note of the patient's grunts and groans, and you wouldn't want to do a push-pull on a patient that's lying in pain, would you? And of course then there's the back rub. Now what were the back rubs for? Well, funny enough, they were to get the circulation back into the muscles, so that they'd flow a little bit better. So when the person actually got up, they wouldn't be in a sort of state of semi-rigor mortis. Otherwise they'd have a load of rigor mortises all over the place, as we got now. 50 years later, 60 years later, we're giving them pain pills so that they are going to sleep in the same position, and they are going to wake up in pain and take some more pills. Whose big idea was that? So what I like is the accents that I hear. As a sound engineer, I'm trained to hear inflections, emotions, area of breath, area of tightness, the full spectrum of a voice. People's voices express who they are, where they're coming from, and where they've come from. Now, I've had massage pretty much all my life, whenever I could get it. So when I go to the doctor and they say that massage is not proven, I tend to look at them and see exactly what I'm looking at. There's a person that's not had massage. There's a person that hasn't been asked for massage before. There's a person that hasn't even thought about massage. There's a person that hasn't done any educational training on what massage actually does. There's a person that doesn't know the efficacy of massage. So as I said, I'm massaging my hip, trying to get the circulation back into it. I'm finding very tight bits, loose bits, quite a spectrum from loose to tight. Whereas in the old days it was all sort of pretty much a muchness. It was like you couldn't tell what was tight and what wasn't tight. All you knew was that there was pain there. Of course, it took me a long time to be able to go deep into it to find the culprits, because it's not something that you understand with your mind, because you've never been taught. Even though you've had massage, you think to yourself, well, I've got to go in there deep, but I can't reach that spot. So how am I going to go in there deep? What with? Do I have to get a cricket bat? A baseball bat? A hockey stick? Or should I go and get a bit of that very thick, springy rubber foam that's on my water pipes? Take that off and use that. Well, after a while of asking people to give you a hand, seeing as we've got this rich and poor divide, you've got the people that are working, they can go and get their massage and they can pay for it. Then they can have lovely little conversations in the park about how wonderful it is. Then they can meet someone in the park that's going, I wish I could get a massage. And they go, oh well, I always have mine in down in Mayfair. They're really good specialists down there, you know. You want to try it? Or you get, oh yes love, a chance would be a fine thing. I mean, I don't know much about it, but I've heard it's good. What's it do then?